All right, today we're going to learn about the scapula, your shoulder blades. This is your right shoulder blade. To learn the orientations, first you can locate the spine of the scapula. That is always posterior. And then this little socket is where the head of the humerus sit in. So that's your glenoid fossa. So once you locate that, you know it's the left one or the right one. Now from here we can see over here that little rough place where muscles attach. We'll call it infra below, so infraglenoid tubercle. And then over here on the end, that process of the spine of the scapula is called a acromion process. It articulates with the clavicle, the collarbone in the front. And then we learn about all the fossas, the surface area of the scapula. First, this is your supraspinous fossa on the top, and then infraspinous fossa on the bottom, subscapular fossa in the front, and then that's about it. That's the fossas. And basically, these fossa are where the rotator cuff muscle sits in, like infraspinous, supraspinous muscle, and then subscapularis muscle. And so over here, that little knot or that little bony area is another process. We call it a coracoid process. Coracoid is like a bird's mouth. Coracoid process. And then there's a notch here that is our supraspinous. Let me make sure I do it correctly. This is suprascapular notch. So subscapularis, suprascapular notch. And then we have different angles. Over here is your superior angle. Over here is your inferior angle. You have the medial border towards the center of the body and lateral border. And that's about it. This is your scapula. Thank you for watching. In this video, we're going to learn about the bony landmarks of the humerus bone, the funny bone. There's no funny bone. It's just trying to be funny. So this bone, basically, to learn the orientation, basically you have to know if it's the left one or the right one. If you only look at the head of the humerus, it can be the left one. It can also be the right one. So another way is to find this bigger hole compared to the front. Right? This is our olecranon fossa, and that's where the elbow bone that you can feel sit in. Olecranon. So the elbow can only go this direction. And we can locate, oh, this is the left arm bone. Okay, from here, let's talk about this little round ball-shaped area that is our head of the humerus. When you have a head, you have a neck. So that's our anatomical neck of the humerus. If you have a ring right at this area, that would be the surgical neck of the humerus. Over here, you have the greater tubercle, and over here, that's a lesser tubercle. It's hard to tell from this view, but if you look at this way, you can see this knob is much bigger than that one. Greater tubercle, lesser tubercle. Between the tubercle, there's a groove. We call it a sulcus or intertubercular groove. Moving down over here, that's your deltoid tuberosity, where all the deltoid muscles attach. And then moving down, that's your radial groove. And since that's the direction, we know this is the medial side towards the center of the body, medial supracondylar ridge, and then that's your lateral supracondylar ridge. Over here is your medial apicondyle and your lateral apicondyle. Going down, this little area is where this is your ulna, sits in and doing this movement, and we call it a trochlea. So trochlea fossa or trochlea. And then over here you have where this is your radius, that's your ulna. So the radius sit in here, and we call this capitulum. It looks like a little head, round shape. So capitulum. So after capitulum, you're basically done on this side, except for this little groove over here. That's your coronoid fossa. Basically on the ulna, you have olecranon process and a coronoid process. And when you are rotating, this coronoid fossa sits, coronoid process sits right in the coronoid fossa. Okay, there's another little groove that is right beside it. That's your radial fossa. The last one is when you turn it over, that little big hole that we talked at the very beginning. That's your olecranon fossa. That's the humerus. Alright, now we're going to learn about the ulna and the radius. How do you tell which one is which? When you see a letter U, ulna. Alright, now let's take a look at the bony landmarks. Think of the humerus, right? We learned about this is the olecranon fossa, and that is the coronoid fossa, and that's exactly how the process sit in. So this would be the olecranon process, and that would be the coronoid process. And then on the side over here, you have this ulna tuberosity, okay? And then moving down, you have this styloid process, and then the head of the ulna is right there. The styloid process, we also have it on the radius. We also have it on the temporal bone. There's also a styloid process. It's right beside the mastoid process. Now let's take a look at the radius. So radius radiate around the ulna. Now over here, that is the head of the radius. So you have to remember that the radius head is on the top and the ulna's head is at the bottom, superior, inferior. And then when you have a head, you also have a neck, so that's the neck of the radius. And then over here, this bumpy area, that's radial tuberosity. And then going all the way down, that is a styloid process of the radius. Another very important thing to know is when the ulna and the radius articulate together, there's a notch. So the notch that is on the radius is the ulnar notch of the radius. And then on the top, where the notch where the radius sit in is the radial notch of the ulna. So that's it about the forearm bones. Alright, now let's take a look of the hand bones. So over here you have the phalanges, the fingers. You have two finger bones in the thumb. So the outer one, that is your distal phalanx. Phalanx is the bone name. And then you have your medial phalanx. So distal phalanx, number 2, medial phalanx, number two, and then this middle phalanx, that's something the thumb does not have, but we also count it as 2, though we don't have number 1. And then the same rule, distal phalanx 3, middle phalanx 3, and then medial phalanx 3. And then so on and so forth of all the finger bones. And then over here you can see your metatarsals. This is big hand. Okay, metatarsos. Metacarpals. Yeah, tarsos are on the feet. Carpals, metacarpals. So metacarpal 1, metacarpal 2, metacarpal 3, metacarpal 4, metacarpal 5. You write it in a Roman numeral form. And then over here we have 8 pieces of small bones. And all the small bones have a special name, and there is an acronym my teacher shared with me. It's called a straight line to pinky. Here comes the thumb. So the S is scaphoid, line, lunate, like a moon shape, lunate. Then you have there are 2 bones, one in the front, one in the back. The one on the back, that is called a triquetrum. The one in the front is the pisiform. So if you touch your palm, your wrist at the bottom, that's your pisiform. And then from the pisiform going up, there's another little bone called hamate. Sometimes you hamate something, that's the hamate. And then you go to the middle finger, that's your capitate. So capitate, anything cap is the head. So there's a very interesting way that our teacher helped us remember. If you show me your middle finger, disrespect, I'll cut your head off. So middle finger related to the capitate. And then the next one is trapezoid and trapezium. Trapezoid is a smaller triangle shaped bone, and then trapezium is a little bit bigger. So one more time, scaphoid, lunate, triquetrum, pisiform, hamate, capitate, trapezoid, trapezium. That's a hand bone. Alright, same thing with the feet bones. Your hand bones named very similar the way you name your foot bones. So first, those are your phalanges. That's your distal phalanx number 1, distal phalanx number 2, 3, 4, 5, and then middle phalanx, which you don't have on the big toe, but you have middle phalanx number 2, 3, 4, 5, and then you have a proximal phalanx 1, 2, 3, 4, 5, and then metatarsals, metatarsal 1, 2, 3, 4, 5, and then you have the green color ones are the tarsal bones. Totally we have 7 pieces. And start on the top, this piece that articulate with your tibia and fibula, that is your talus. At the bottom of the talus, that's your calcaneus. And the medial side of the calcaneus, that's navicular. If you take it out, it looks like a boat shape, navicular. And then on the side, this one is cuboid. Then you have the rest of 3, medial cuneiform, intermediate cuneiform, and the lateral cuneiform. And those are the 7 pieces of tarsals.